So now I'm so pleased to introduce Jemma. Jemma is an active and fantastic part of Kidney Cancer UK Patient Council Group. And Jemma has a full-time job at Cadbury's. And for the past 2.5 years, Jemma has been dedicated to cancer ambassador training, educating employers and colleagues, and providing practice and information advice on the approach of cancer, talking about cancer in the workplace. So, and as of last night, Jemma also won the award, which she's kindly showing here, for her contribution to driving organisation change award for DE&I. So massive congratulations, Jemma. And yeah, without any further ado, over to you.
Thank you. So welcome to this Navigating Kidney Cancer in the Workplace. This could be any cancer within the workplace. And that's myself, Jemma Falloon. So who am I? Who is Jemma Falloon? So I'm wife to Mark, mum to Lewis, Magnus and Bronwyn, chaser of the Northern Lights. That's my thing that I like to do. And I'm the cancer and menopause lead at Mondelez. And due to the things that I'm getting myself involved with, I'm a newly qualified associate CIPD. For anybody that doesn't know what that is, it's a HR qualification. So just to give you a bit of background, because I think sometimes we find it frustrating as cancer patients that we go into appointments with people who make choices about our time at work or other things that have never been on a cancer journey, and so don't understand what somebody has gone through. So back in October 2020, I got a positive COVID test. Nothing unusual about that. But 8 weeks later, I couldn't get a negative COVID test. It just kept coming back as inconclusive. So I went to my GP to explain that I couldn't get one. Work wouldn't allow me back without a negative test. And she said, I can see something in your neck. I'm going to refer you to for a scan. So I said, okay. My voice kept going, and I had just assumed it was because of the COVID had left me with a bit of a nasty throat. At the same time, I started getting pain in my left-hand side, and there was some blood in my urine. So they assumed that it was just some issue with calcium, my parathyroids, and that would be the link between it. So I went for a scan on my neck, and we discovered a 2.5 centimetre tumour on my thyroid. I then was scanned on my kidneys to check to see if the bleeding and the pain was due to my thyroid, and it was calcium deposits in my kidney. It was then that I discovered that I had a 4 centimetre Bosniak cyst on my right kidney. So on New Year's Eve 2020, within 3 hours of each other, I was diagnosed with both thyroid and kidney cancer. What happened after that was, as you can imagine, urology and ear, nose and throat deciding which part of my body they were going to operate on first, and how that would look. Urology won, and I went in March 2021 to have a partial nephrectomy. 6 weeks later, I got my results, and I was still bleeding, and I discovered that I'd had positive margins, so there was still some cancer left in. But ear, nose and throat, we're still looking at doing my thyroidectomy. So I had a half thyroidectomy in May 2021, then a full thyroidectomy in June 2021. I was still bleeding after another 6 months. So I've had 3 renal angiograms. I then discovered that I had a genetic condition called Cowden syndrome that puts me at advanced risk of kidney cancer, thyroid cancer, ovarian cancer, and a couple of other cancers. So I then had a preventative hysterectomy. I then had some work done on my esophagus because they found a lump there too. And then in October 22, I had a completion of my nephrectomy. I'm also taking hormone replacement due to the risk that I have. I can't take hormone replacement. I'm having hormone blockers due to the risk of the breast cancer that I could get due to the genetic condition. At the time I was working, I had 2 young children at home. One was 2 and one was 4. And as many of us do when we get a diagnosis, I went straight onto good old Dr. Google, and I went onto Dr. Google on my company's intranet system and typed in what happens when I get cancer into my work system, and nothing came up. Assuming it was New Year's time when I'd got the diagnosis that the system was down, I then typed it in again, nothing came up. Came back to it a couple of days later, nothing came up. And I thought, that can't be right. I work for Cadbury's, Mondelez, one of the biggest companies in the UK, in the world, and there's just a system fault. So I was then put in touch with a lady called Anita in our employee relations team who'd had cancer in her family, and it was a real passion of hers. But unfortunately, as a business, the support was there with regards to the questions that we had, but there were no resources and nowhere for people to find these resources. So that's while I was on off from work, I developed the cancer support at Mondelez and the I'm a Cancer Ambassador scheme. So what this meant, so it means that all employees and managers have a guide on what this looks like, so that we already know as cancer patients, there's a big postcode lottery with regards to the consultants we get, the treatment we get, and timings. And we didn't want this to be a postcode lottery. We wanted every employer, regardless of the site or their manager, to be treated fairly and consistently. And these guides allow us to be able to do that within the organisation. So the Cancer Ambassador training. The Cancer Ambassador training is a 3-hour face-to-face or Teams meeting. This doesn't last 3 hours. It's typically about 2.5, but gives the employee half an hour to go away and reflect and look back on what they've just been talking about, because it can be an emotive subject. We then took, how would you reply if someone came to you today to tell you that they had cancer? That's the question we have. And we find that most people find that really awkward to answer that question. We ask that at the beginning and at the end so that we can show the progress from the training that we've had. We talk about what is cancer. I'm not an oncologist, I'm not a nurse, but we just talk about the basics of what cancer is, the cell division, and how that is shown on a scan for people to be able to make that assumption. And what are the stages of cancer and what do they mean? This is the bit that a lot of people say that they learn a lot from. That people didn't know there's a stage 0 in some cancers, which means that the cells are there, they're not at a stage 1. And we also talk about stage 4 and what that would look like. And a lot of people feel that stage 4 is terminal, whereas my thyroid cancer had come back and is classed as stage 4, but it's not terminal. I'm treatable, not curable. So we talk around that too. We talk about the types of cancer and how many cancers there are, 200 different cancers, but the top 4 being that take up 50% of those cancers. We talk about cancer treatments such as chemotherapy, radiotherapy, immunotherapy, and operations and surgery. And we talk about the side effects of cancer and treatment. And we do this to lead up to asking people how they would help people within the workplace with cancer. We then do some work around empathy and sympathy, because as a cancer patient, there's nothing worse than somebody telling you that my auntie's uncle's cousin's brother had the same cancer and he was fine, or that this is what he did, or this is how long it took him to recover. That isn't what cancer's about. Cancer's about recognizing that the person is going through cancer, and it's a very individualized journey that we can't compare people with. We talk about active listening and the fact that most people listen to answer and not listen to understand. And we go through active questioning, how that looks like to somebody with cancer. And we talk through conversation examples in a safe space. And due to the fact that I've been through cancer, I'm able to have those conversations with people in a safe environment where they can ask questions to me before they go and be a cancer ambassador. We talk about handling emotions, because there are a lot of emotions when it comes to somebody being diagnosed with cancer. There's anger, there's guilt, there's frustration, and it's about talking about how we can handle those emotions. We talk about safeguarding because that's the right thing to do, and with those emotions become thoughts and feelings that some people just don't know what to do with. So we safeguard, and then effective signposting. The effective signposting I use is to reputable charities. So I align myself with Kidney Cancer UK because that feels to me the right thing to do. They're a charity that look into developing and researching and looking after the patient, and it isn't a case of with some charities they and this is my own personal view and not Kidney Cancer UK's view, a lot of charities seem to want to sell you a hard story about somebody with cancer, whereas Kidney Cancer UK's story is about educating and looking after the patient. This is the biggest thing that I feel was important in training in the workplace, and it's life after cancer. And I think this picture tells it quite well. What people see is somebody back at work with gratitude, resilience, and the hair's grown back, although a lot of us don't lose our hair. But what people don't see is the mental and physical fatigue, the hospital appointments, the financial strain, the change in identity, the dietary change, the scars and trauma, the sensitivity, the change in relationships, and the list could go on. I often refer to myself as a swan, looking nice and serene on top, but pedaling madly underneath to try and carry on. We signpost to internal resources, and we the support available to you as a cancer ambassador. We have regular check-ins with all of our cancer ambassadors to ensure that their mental health is in a good place while doing the cancer ambassador scheme. We have quarterly catch-ups where we go through stories of people within our business who have been through cancer or have supported somebody through cancer. It's important to recognise that there is employment rights to somebody with cancer, and in the UK the Equality Act 2010 protects people with cancer from discrimination at work. This means that employers cannot treat people with cancer less favourably than others, and it means that your unfair treatment at work, being made redundant and having your job conditions change without your consent. The right means that you can ask for reasonable changes to your work or workplace, the right time off work for treatment and recovery, and the right to more flexible working hours. And you need to talk to your employer about that, HR managers, trade unions, and you need to do that formally in writing. And if an employer doesn't agree with your request, your employer must put it into writing and explain why, and it must be a business reason. And if not, you can appeal your decision or go to employment tribunal. You also have carers' rights, which is something that's really, really important to me. My husband struggled while I was going through treatment and wasn't supported in the workplace that he worked. So for me, it was important to recognise the really important work that carers do, and carers have rights too under the Equality Act of 2010. As cancer is considered as a disability, meaning you have legal rights to request reasonable adjustments like flexible working hours to manage your caring responsibilities. This protection applies even if the person you care for is in remission or has finished treatment. So just as we mentioned before, I've won a couple of awards, organisational change and individual contribution award at my company's national and international awards. I've spoken to 1,600 people at Grocery Aid about the power of colleague-led support and wellbeing support for cancer, and I always do that wearing green. I've recently spoke at a Understanding Cancer in the Workplace conference in London with a big mental health, not charity, but an organisation. And on World Cancer Day, we did an Instagram takeover, which was the most successful that they've ever had. So if you have any questions or any feedback, I would welcome it. And if you'd like to get in touch, please contact me on Facebook. I'm on the kidney cancer page, and that's my email just there. I am available through Kidney Cancer UK to be able to support people within their workplace to set up cancer ambassador schemes if you wanted to. And I'm also available to help with regards to looking at manager and employee guides and looking at policies if that's what people would be interested to learn more about.
Perfect. Thank you, Jemma. We just have a couple of questions in our chat we can go into more
Yep.
detail on. Being asked, where did you do your training to become a cancer ambassador?
I developed the training myself. In my previous life before Cadbury's, I was a trainer for two Tesco's and Boots. I worked for two large organisations doing training, and there was no training out there that for to be able to support people in the workplace, and it was something I was quite passionate about doing. So I've done the training myself.
Perfect. Are there any top tips that you would give somebody who has just returned to work after a diagnosis to begin discussions in the workplace? For example, would they go to HR or their manager? Is there any tips on how you sort of start that?
Yeah, I think it depends on the relationship that you have with your manager or the size of your organisation and what that looks like. So if the person who asked that question wanted to ask it and give me a bit more context, I'm happy to answer that. Or I work for a large organisation, so I went directly to my manager. My manager then went to our HR function to see what that would look like on my return to work. I think being really open and honest about your health in that instance is really important. And I talk sometimes about I'm my own worst enemy. I believed that I was going to come back to work within 16 weeks. I was going to have had my kidney out, my thyroid sorted, and I was going to be back to work straight away doing the job that I was employed to do. And that's not the case. If you've ever tried to get up out of bed having had a robotic partial nephrectomy, it's interesting, and I didn't factor in the pain that I would feel, or the tiredness, or the simple things like changing bowel habits that knock you off and make you tired. So I think it's really, really important to be honest with how you're feeling and don't go back too soon. Also ask for regular check-ins, because you may think you feel okay, but then going back to work may take you back 2 steps. So it's okay to acknowledge that as well. And it's reasonable adjustments, as long as you're not asking for the next year off or doing 2 hours a day for the next year. No employer can refuse reasonable adjustments.
Perfect. Thank you, Jemma. I just have another question.
Yeah.
Is this something that can be adopted to all organisations? For example, have you gone to NHS England and other organisations similar to them?
Yeah, I have been approached by NHS North Wales to work with them to do the training. I should have mentioned before, I do 4 days a week at the moment with the employer that I work for, and I'm doing this 1 day a week in my own time. I'm going to be working with NHS North Wales. They're looking at doing this with their volunteers so that they could. So the people that go round, or the people that welcome you, we know we have a lot of anxiety as cancer patients. So I get a lot of anxiety when it's scan time. So I may react differently or be a little more anxious when I go for a scan, or while sat waiting in a waiting room, tapping my legs because I'm anxious. It's about people recognising that we're a bit unique in how we want to be treated. I don't want anybody's sympathy. What I've been given, I've been given, but I want the empathy and the understanding that sometimes the way that I behave in situations or want situations to go is because of the cancer and the things, the pain that I get, or the tiredness that I get.
Yeah, thank you, Gemma. We have another question here. So I've recently started back at work, and the term phase return came with a reduction in pay, essentially only being paid for the hours I work. Is this normal?
No, not at all.
Mm.
Um, a phased return to work should be getting you back to work. That's the sole job of a phased return to work, and it shouldn't be reduced in pay due to the in effect your disability. You're wanting to come back to work.
Mm.
If you want to contact me, I can send you some legislation around a phased return to work and what that should look like.
Brilliant. Thank you, Gemma. Um, would the training cover voluntary sectors for people who have retired from work but volunteer?
Yep, I think that's what NHS and North Wales were looking at, being able to do that with their volunteers. The training, I'm very fortunate with the role that I do. I look after 4,000 employees, and it's kind of an equal split of men and women. Um, and I can say this because I have a man of my own. Men are useless at talking about cancer, and especially in the workplace. And sometimes they're the people, due to procedures, need the biggest adjustments within the workplace. We did a big campaign with Oddballs underwear, and we gave 1,500 pairs of underpants to our men with our Cancer Ambassador logo on. So, in the hope that every man that within Mondelez that pulled up these underpants, however many times they pulled them up, would remind themselves to check themselves. So I'm in the fortunate position that I've worked with some of the toughest people when it comes to getting this cancer ambassador training across. And I'm very fortunate and I'm quite articulate, but this is when I get quite emotional. I've trained 200 people within my workplace to be cancer ambassadors. That's 5% of my workforce to be cancer ambassadors, and it's saved lives. And we've got proof that that's what it's done, that the people that they've gone to and talked to have advised them to go back and question why they haven't been seen for 4 weeks. And the communication piece around the cancers that we talk about has enabled people to check themselves and go to their doctor and start receiving treatment. And I'm a massive ambassador that the more we talk about cancer, the less it's a taboo. The less of a taboo it is, the more it will be found traditionally at an earlier stage. We know that that's not always the case with kidney cancer, because we usually get found at a scan that we didn't have any symptoms for. But the more we talk about cancer in the workplace, the more people feel comfortable. And I truly believe that absence will drop because people will want to come back to work because they feel supported to come back to work, and they feel empowered. Hopefully people after this will feel empowered to go away and start it within their own organization. I was one of the lowest grades within Mondelez, so I wasn't anybody that usually would have had this kind of impact in the business, but I was determined that this was a conversation that needed to be had. And I now have conversations with people at all levels within our organisation because they understand the impact and the importance of it. If you look at cancer, we reckon that impacts 1 in 2 people. But if you have a LGBTQ plus network, that doesn't impact 1 in 2 people. Families and fertility doesn't impact 1 in 2 people. Neither does the menopause or other things. So this needs to be a business focus. And also because there's individuals, we're living longer. So we need to look at how this happens and how this impacts our employers going forward.
Definitely. I think you touched on some really valuable points there, Gemma. Feeling comfortable, coming back to work and being able to talk about what's going on in your personal life and how your work can support you, and not that expectation of being able to completely pick up where you left off either. And I think that's what you're doing here is really helping people with that support. So yeah, brilliant. And someone else commented here saying, keep up the great work. This is amazing. And you'll just help so many people with this. So thank you. And just have one more question here. So my partner today has been told that he luckily doesn't have kidney cancer, but he has but he has lost his right kidney, as wouldn't be considered for disability under the Equal Acts, and only has one kidney and will work normally traveling abroad and at home. Is there anything his employer would have considered from a legal perspective? Sorry, that was probably didn't that was
Let me have a look at
break
it on
that
the
down a little
screen
bit
so I
more.
can. My partner's been told today he luckily doesn't have kidney cancer, but he's lost his right kidneys. He won't be concerned. No. But is I think my question around that, in with regards to if I was bringing somebody back to work, would be what were you looking at as with regards to changes? Does he not want to go abroad as often as he does? Does he? I would need a bit more background, but again, I'm more than happy to have that conversation offline if somebody wanted that conversation. And just because he wasn't diagnosed with kidney cancer, it doesn't mean that the fact that he's just had a major operation and one of his major organs removed, it doesn't take away from that. So the phase return to work and the how he should be treated should be exactly the same as if he had been diagnosed with kidney cancer.
Brilliant. Thank you, Gemma. And one from a colleague perspective as well. My colleague was recently diagnosed with cancer, and I didn't quite know how to go about it in the office. Is that something that we should carry on as normal? Should I approach it in a different way? Do you have any tips on how to handle this within a working environment?
Yeah, we this is what we talk about in as part of the Cancer Ambassador scheme, and it's a really awkward conversation, isn't it? When somebody, even myself, when someone comes to me and says, "I've got cancer," your mind jumps to many places. And I would say the biggest thing I teach in the Cancer Ambassador scheme is that the worst thing you can do is say nothing.
Mm,
I truly believe that if you say something and it comes from a good place, the person understands that. And I'll give context to that. I was told by a relative that I was lucky that I didn't have serious cancer because I still had my hair.
mm,
Which I believe is a naivety, or the way that the press and other charities lead you to believe people with kidney with any cancer are. I've had 10 operations and I'm on meds for cancers that I don't have. I consider myself extremely lucky with how my journey's turned out, but it hasn't been the easiest of
mm,
journeys. So I think, to go back to the question, just speak to them as you would before they got cancer. And if you find that conversation awkward, it's okay to say you find that conversation awkward. It's okay to say, I don't know I don't know what to say, but please let me know how I can support you, or I'm finding this really awkward, not because
mm.
I don't care, but because I don't know what to say and I don't know what you want. Help me understand what it is that you want. And that um some people don't want to talk about the cancer, and that's that's their journey. And I feel possibly luckier with kidney cancer, if that's the right word, because it's not breast or testicle or a part of my body that may be seen as being private. So I talk about wee and poo all the time with people at work who have had bowel cancer and I've had kidney cancer.
Mm.
um, but just carry on talking to that person. Don't let them feel isolated, because having cancer sometimes can be quite isolating. If you don't want to talk about cancer and they don't want to talk about cancer, talk about the weather, talk about the sport, talk about their children, their grandchildren, but
Yeah,
just remember to have a conversation.
they're a human being. We're all human beings.
Yeah.
Okay?
Yeah.
Yeah, completely. And just a final question we got. If anybody does have any more questions, please feel free to pop in, or I'll share Gemma's details again at the end, and you can contact her directly. But the last question we have for the moment is, where can I get support if I'm feeling unsupported in my workplace?
Yeah, I think you if it's regards to returning back to work, or if it's once you're back at work and your adjustments, you should have a grievance policy that you can go to, and that grievance policy should allow you to let your employer see where you feel they're going wrong, and they have the chance to reply to that. in extreme cases, that would go to employment tribunal, but that would be in very extreme cases. And yeah, I would hope that most people these days, again, if that, I don't know too much context around how that person's not feeling supported, I'm happy again to speak to you with regards to that. And that's why I've done my CIPD level 5 training, because I met a lot of people. You kind of get your own little cancer buddies, don't you? Your own little cancer friends who are people that are who you feel get you. And it horrified me, some of the stories that people were telling me about how they'd have to have chemo in their lunch break, or their employer. Lots of horror stories. And that's why I went back to college to do my HR degree, because the world needs to look after people in the workplace who have got cancer.
Completely. We just had one more question come in. Sorry,
Yeah.
Gemma. One more question. I'm a new employee, and I'm a new employee and get diagnosis. Sorry. I'm a new employee and just been diagnosed. Do I still get the same rights?
I think it will depend on how long you've been there and what your contract states. You should still be treated fairly under the Equality of
Yeah.
2010 Act, and they can't dismiss you because they can't terminate your employment due to you having time off due to cancer. You can still have a phased return to work, but with regards to pay, that would be up to the business themselves.
Right. Yeah, that makes perfect sense. Well, that I think is all of our questions. I'll just triple check, but really informative. Thank you so much, Gemma. And like I said, if anybody has any further questions, we can put you in touch with Jemma Falloon as well. And this recording will also be available next week. And yeah, it's really informative, like I said, Gemma, and thank you so much for your time. And yeah, like I said, if anyone's got any more questions, I'll just leave it up for a few more minutes. But if not, thank you to everybody who has taken part in Kidney Cancer Awareness Week. Like I said at the beginning, it's been amazing to see so many of you involved, and people like Gemma and other webinars that we've had this week. But yeah, thank you so much. And getting a few comments now saying thank you, Gemma. Thanks to all. So yeah, brilliant.
If anybody would like to set up a cancer ambassador scheme within their organisation, I'm more than happy to help support do that.
Brilliant.
This is the reason I came on. The more we talk about it, the more it becomes an easier conversation. My cancer is genetic, so I'm hoping that if it's something that my children end up with, that the conversation is much easier when it comes to my children. So
And the
if
best way
anybody
is to contact you with your
yeah
email.
yeah give me a message, and we'll have a look at let's have a look at what we can do within your place of work.
Brilliant, thank you. Oh, I just had one more comment, if that's okay.
Yeah,
I have to start my generic testing this year. What's involved?
it's a blood test. It's as simple as a blood test. I had it done. It then goes away to a specialist lab. It can take up to 6 months because of the testing that they do. It then comes back if you have any. Hazel may be better at answering this. It came back to say that I had a genetic problem that was linked to Cowden syndrome. If they didn't find anything in the first instance, they can then send it back. There's a clinical trial at either Oxford or Cambridge, and they're looking at people who are either under the age of 40 and people who are under the age of 40 or have had kidney cancer in their family. They're asking people to donate their blood to that, because as much as there might not be a genetic condition right now that you're linked to, who knows in the future what they find, because in the UK we're quite behind with genetic testing compared to other countries.
Perfect. Well, I hope that answered that question. And thank you for everybody else who's put questions in the chat today as well. And as Gemma said, if you'd like your cancer ambassador scheme at your place of work, please get in contact with either Kidney Cancer UK or Gemma, and it'd be great to set all that up. So Yeah, thank you so much, Gemma. And thank you for
Thank you.
everybody who has participated. And yeah, we will speak to you all soon. Thank you.